especially, the next 30, 40 years when we're all going to be in there, and we kind of want the healthcare industry to be fixed by then, right? Because if not, then we're screwed.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and this is the first in a series of special episodes surrounding an important topic right now in the industry, which is Medicare STARS. A lot of the audience might not know this, but I actually work for an insurance company as my day job, and my focus is on Medicare STARS. With the recent news that's come out, we've seen a lot of organizations that have had a downgrade in their star ratings and lost billions of dollars in some of these payments. So we're having some experts in the stars industry come on to explain. And this first episode is just going to cover kind of the basics of Medicare stars. I reached out to Zachary of the Veracity Consulting Group. Zachary, please introduce yourself and your experience in the industry.
Thanks, Cole. Yeah, so Zachary Berger, Zach Berger is what I go by. Only my wife and my mom call me Zachary, and then I know I'm really in trouble. So I'm a director in our business advisory group for Veracity Consulting, which is a subsidiary of RGP. In that group there, we are focused on a lot on health plans and a lot on strategy execution, project management, process improvement, and basically fixing problems. So um, I've been in the consulting world for a little bit over 15 years now, and with the last, I'd say, 10 or 12 years being solely focused on health plans and government programs. So, I worked for a previous company out here in Pittsburgh, and really focused and honed in on my government program side of the business, understanding all the issues and challenges that they have, and then moved over to Veracity a little over 2.5 years ago to help them start a Medicare Stars offering, and use their strengths to really bring it to the market.
Thank you so much for coming on, Zach. I really appreciate your time. Uh, can you just first start? Because even myself, I've only been in the stars space for almost 11 months now, and I still don't really know what it is. And of course, you can read on the internet articles and things, but from your perspective, what is Medicare stars and why do we care about it?
Yeah, I mean, there's a couple things, right? And I'm not gonna bore you with all the jargon and the technical factors of it, but really, what it comes down to, if you look at Medicare Stars, it's a quality assurance program for health plans, right? So, this all started back when uh, Medicare Advantage plans, they spun up, I think, back in 2007, right? Basically looking to find what everybody's looking to is affordable health care and being able to be covered by, fully, and not have any type of donut holes or any type of gaps in care, right? So you had these Medicare Advantage plans that came together, and they started um, these these health plans to service their members. Obviously, grow some of the population, and make revenue off it and run it almost like a commercial plan. And then, with that being said, you had CMS coming in and say, hey, we're the kings of and queens of Medicare, right? We're going to tell you what we need to do and how we're going to check this. So really, all Medicare stars is it's a rating of 1 to 5, right? Five being the best, one being the worst. And with that rating, there's different types of measures and I believe it's 40 measures now that are measured in these health plans, and there's different circumstances for how you're eligible for those, and the different health plans might have less measures, but at the end of the day, it's really looking at how you can basically improve the outcomes of your your members, and keep them healthy and keep them a healthier population. So these measures are all focused on things like colorectal screenings or breast cancer screenings, things like customer service and how do you rate your health plan, and medication adherence for diabetes measures. All those things that you're really looking to manage as are in that Medicare population to keep that population healthy and keep your risk level lower. So, if you get that 4 or plus star rating, right, there's some incentives tied to it based on how many members you have, and really those incentives are come on two forms. One being quality bonus payments, which they're received by the actual plan to as part of the revenue, right? And they're able to really use that as their as revenue, and that's dependent on if you're a 4 star or above, and it can go up a little bit in percentage on how much you get paid in that quality bonus payment. And I think just the other year, I forget if it was last year or 2022, I think CMS awarded around $10 billion across the industry for those bonus payments. So you can imagine, what that looks like if you have a good market share of members. And then the second piece is rebates, right? And rebates are really to put back into the plan and really help bolster things like secondary benefits or supplemental benefits, lower premiums, and really help improve the members' outcomes through giving them more tools and capabilities within the plan. So, the tricky thing is that you have Medicare STARS. There's measures, right? There's 5 different categories, and those categories really run through HEDIS, which is more of the clinical measures, and they're maintained by the NCQA. You have Haas, which is really looking at the improvement of things like, if you improved your falls, right? If you didn't have a fall or incontinence, it's looking at through a cohort and looking how they improve. Pharmacy, which are things like medication adherence. Operations, which appeals and grievances. And then the last thing, which we'll mainly talk about today, is really around caps and member experience. It's directly tied to how members perceive the plan and how the plan's actually managing those members to have those better outcomes. So those 5 different categories make up the overall all-star score, and each one of those categories, they're not weighted the same, or the measures aren't weighted the same. So you kind of have to look at them, and if you don't have a really good star strategy, then you might be trying to punch holes in some things and put band-aids on other, right? But having a comprehensive strategy and really looking at what drives each individual measure and focusing on a lot on the higher weighted measures are going to get you halfway there, and then there's other things that you could get the other half. But yeah, I mean, in a nutshell, that's stars, and I will say it's a little bit of a weird calendar, right? So we just finished up the 2024 star cycle, which was for 2025 star ratings. So they just came out, I think, a week or two ago, right?
Yeah, that's when all the news headlines started to break.
Yeah, you saw the news, and everybody starts, trying to sue CMS and talks about their calculations being off. But really, what made that up of that is it was the 2023 from January 1st to December 31st of 2023. That whole calendar year, which they were measuring things like HEDIS, clinical measures, operational measures, and then as you get into 2024 and you get into the Q2, that's when they start doing medical chart review to help increase some of those HEDIS measures. And one of the most important parts is the CAP survey, which comes out in Q2 of 2024. And then they compile that data over a year and a half, and they come out with these star scores in October, but they're actually for 2025.
So it's that weird leap system, right? It's a weird leap. And then to summarize, just before we get into the caps portion, it's a 1 to 5 star, and it seems like when you get up to the 4 and the 5s, you start getting these rebates, you get these bonuses, and then it becomes easier to grow your membership, easier to make more money, of course, which then you could use that money to fund programs which benefit your members. And so and you said there's 40 measures, so strategizing is important, but it seems like strategizing is especially important if you are a lower star plan because you're going to have less bonuses, less resources, and you need to increase the star rating. That seems to be a challenge. Out of those 40 measures, you say that you at your organization focus on caps. Why is that? Because it seems like a lot of organizations focus on things like HEDIS or focus on pharmacy. They invest a lot of money on these, quality things. And not saying that you don't, but you did say that the focus really is on caps and that experience. Why is that the case?
Yeah, and I just want to make it clear. It's not just caps that we focus on. Uh, with our organization, the way that Veracity and where our strengths are is really around experience, right? So, although caps is pretty much tied to directly to member experience, if you were to peel back the layers and look at HEDIS or look at operations, those things also contribute back to member experience. What my organization, what we're not really focused on too much is kind of getting real deep into the weeds and trying to really, look at things, data and predictive analytics. That's great stuff, and I know there's some great platforms out there. We don't have that capability right now, and instead of trying to the market right now for Medicare STARS is so saturated, especially in these last few years, that everybody's trying to get a piece. And I see a lot of companies trying to do everything and get the full market share rather than really looking at the overall goal of helping out the members and helping out the health plan industry. So with us, really, it's really focusing on what we're good at and our strengths, and partnering with other people. We're trying to partner with other companies to bring the whole issues or the whole solution to head and provide solutions that are right for the client. So when we talk about star scores and we talk about you know what we do at Veracity, it's really focused on member experience, and there's a science behind it, right? So the group that we work with, right? So I work in our brand advisory practice, and we have a lot of smart people there, and we focus on advisory, strategy, execution, like I said before. Well, we also have another practice that's our brand experience practice, and with these folks here, they are dedicated to their career. These people have PhDs, and they love their jobs, and they're very good at it. And I was able to partner with a few of them on projects, and just some of the outputs that they have are absolutely amazing. But really, what they're doing is they're really getting the health plan to understand their member and their cohort, right? And where they are. I mean, if you look at a plan that's maybe out in Los Angeles versus a plan that's maybe in North Carolina, right? Two differently total cultural differences, different issues, different social determinants of health issues. And what health plans do is they don't really focus on what makes that member want to engage or not to engage, and why can't we help change their thought process. And that really becomes because they don't understand the member, and it takes a lot of time to do that, right? It takes a lot of time to understand that member and put these things in place that are going to help this member and also help you succeed in that stars world. So that's what we really focus on.
What results have you seen that have kind of convinced you at your organization that that is the correct path to take? Because I'm sure some of the audience is skeptical a little bit about this, right? Saying, are we really going to invest in experience that much? There's certainly some hesitancy around that in the industry.
Yeah, and that's a great question. And I was doing I knew that question was coming up, right? So I had some research in my back pocket, but really, if you look at the overall increasing your member experience, if you look at a 5% increase of member satisfaction within health plans, and I'm talking Medicare Advantage, right? what that's really correlating to is about a half a star overall. So if you that's you're talking about going from a 3.5 to a 4 star, and that makes you eligible for this quality bonus payment. So it's right there. And then other things, things like preventative care. If we want to talk about HEDIS, right? So if you look at something, there's 15% increase in preventative care. So if you're taking care of the members that need diabetes or have diabetes and medication adherence and all those clinical aspects of it, they're seeing about a 1 star improvement. So right there, if you're looking at understanding your member and increasing the satisfaction, you could ultimately increase your score by one to 1.5 points. So that's the difference between a 3 or a 4, or 3.5 or 4, or even 4.5, maybe even a 5, right? And with that comes some of the benefits of quality bonus payments, right? When you're at 3.5, you're a half star away. You don't receive any bonus payment, right? You get a rebate, and that's great, but there's no bottom line to it. So, if you have a, a bunch of members, then you're missing out on that money that the government's giving them to help, improve your health plan and improve your administrative areas to help them out. So that's really what the what we're seeing is it's a change, right? It's a change in the mindset of healthcare, right? Healthcare was a lot of data, a lot of improving outcomes through driving preventative services, and it still is. But where we're seeing a big change and where we're trying to get out in front of it is just around the experience side. And I talk a lot about member experience. It doesn't stop there. It's also employee experience. It's also provider. Even you could throw even brokers in there too, right? Um, Sometimes they're the first line of defense when they're trying to re-enroll or sign somebody new up, right? So, it really crosses the gamut of a health plan.
So, is it possible for things like HEDIS and your operations and your pharmacy sections of things to be bad while customer experience is good? Is that ever a scenario that you've seen?
That's another great question. I think you know it, it it depends, right? It depends on what what's being impacted, but I think, in my opinion, and I don't have any statistics to back this up, just because we're not there yet. But I think if I think the experience controls the engagement, which then controls the outcomes, right? So if you take your health, for example, we take a step back and don't look at Medicare Advantage or ACA, or we're just looking at, hey, what would make me want to go to the doctor, right? What am I, if it's going to be, if it's going to, if it's going to take me 2 hours to try to get a scheduled appointment, if the scheduled appointment is going to be 3 months out, if I'm going to have to fill out a ton of paperwork and not understand what's going on, am I really going to put all that effort and engage in there? And if I do, and it's a total disaster, and then you have the back office, right, where it's like the patient billing and the insurance and everything like that. And let's say, you're getting bills that maybe aren't correct or you don't understand. There's a lot of time spent to basically figure it out yourself if that plan doesn't have good experience measures or satisfaction. And I'd say the one example I will give you is that we just did this with a health plan, and a lot of this kind of starts the customer service side. It starts in that call center, right? And everybody thinks a call center is just a call center, right? And I think we can attribute the call center to any part of our life. It doesn't have to be healthcare, right? You could call your cell phone provider or your cable provider, and if they have bad service or you're not getting where you want to be, you get pretty upset. It takes a while, right? And it decreases your confidence in that company. So, what we did is they were having some issues with member experience, and we just focused on their call center. And I think it was a few month assessment with my brand team, and we created personas and journey maps. And at the end of it, we had a whole execution and strategic playbook for them to take and really increase their call center, so they can increase their membership retention and get new members. So yeah, I mean, I think right now I think it's new to health plans. So I don't know if they're actually measuring it as closely as they need to be, but I can say that if you have a bad appeals and grievances process or bad customer service, then I can confidently say that your experience, maybe both on the member and the employee side, and possibly even the provider side too, is probably not up to standards of the industry or where it should be.
So essentially, we can funnel everything down to a root cause of experience and kind of therefore say that STARS really does measure a person's overall experience in the health plan and their overall, the health plan's overall ability to maintain their health, right? Because if a plan's a 4.5 or a 5 star, clearly their customers are probably pretty satisfied with the plan, right? I mean, it'd be hard to be a 4.5 or a 5 and have angry members.
Yeah, absolutely. I mean, you you're you're a consumer, right? You go out and you buy things. Are you going to go on Amazon to buy the thing that's 2.5, or are you going to go buy the thing that's 5 stars, right? So and sometimes if you're inquisitive like myself, I'll go in and read the reviews, right? And you're kind of like, oh, well, these guys they didn't know how to start this thing, or they, some of the reviews you can peel it back and say, okay, well, maybe it's not the best reviews, but not many people are going to do that because they don't really understand it, right? So the first thing that consumers or members are going to do is look at the star rating, or word of mouth. You see a lot of the Humana commercials, or out here it's a lot of UPMC, right? And word of mouth is another big thing too. And you're not going to promote your health plan if you don't like it, right? And that's not going to help you with your patient experience or your member experience within that health plan. But it's the same thing. If you kind of just take everything away and you say, okay, if I was going to go buy something, would I buy something that's 2.5 stars or 5 stars?
You'd clearly buy something that's 5 star, and then to compound that, there's those bonus payments that. So it's not only just a marketing issue; it's also the bonus in the rebate, and that, as we've seen, you said it's $10 billion industry wide. I mean, for a lot of small health plans too, that's substantial, right? I mean, this can amount to millions of dollars for only a couple thousand members, right?
Right. Yeah. I mean, you're looking at, and I forget. It was it's an older number, and it might be for 2022, but I think on the Kaiser uh, Family Foundation, I believe it averaged out to, for just overall bonus payments, to just take an average. I think it was somewhere $300 to $400 per member, right? So if you take that and you extrapolate it based on the membership that you have, right, you're talking a good chunk of money. So if you take that times that by 10,000, right, it's a couple million, right? And you got that, and it's just these bigger plans like Humana and CVS and Aetna, now they're going through some tough times now. I mean, there's some changes that happened with CMS, and there's some controversy going on if it was on purpose or if it's kind of just a mistake. But you see, between last year, CMS went back and recalculated all the scores because 2 or 3 health plans sued them and won. But then you see this year, like, things are coming out, and I think one of Humana's insurance plan that holds like 90% of the members dropped below a 4-star, and it cost them, I think it was like 2% on the market during the day. It was crazy. But even that, and like you look at like CVS, I think last year was expecting to lose $2 billion to $1 billion based on just star score. So if you take that, like those companies, yeah, that's a lot of money, but they can recover from it. But if you look at a regional or a local plan, and they're making, they have 10 or $50 million, and it drops below a certain point, and you're below that 4-star, and you're losing that extra revenue, it's a big impact. And that's not just big impact to their revenue and their bottom line, but and also things that they're not able to do or improve for their members going forward. So it's it's definitely ever changing. I don't think I think CMS is I think they're trying to focus on more of the member experience, but I'm not sure anymore because they had a lot of the cap score and the member experience stuff was four times weighted, and now they've dropped it back to 2. But I think they're trying to also understand where health plans are, and how much they have, how much of the gap they have to close to get them to that point to prioritize member experience to drive everything else.
Very complicated and seemingly ever-changing industry. I appreciate you coming on, Zach, and giving us this great overview. We're going to, of course, link to your profile so people can find you there and get the consulting services. We really do appreciate you coming on, and we hope we can have you on again.
Absolutely, I really enjoyed this. Love coming on. Love talking. Love meeting new people. Yeah, if feel free to reach out to me, even if you have questions. I'm a strong believer that I know I'm in consulting, and there's other consulting firms out there. I think healthcare is broken, and I'm one of the people that I don't care. It's nice to make revenue, but it's also better to improve the healthcare and improve the industry, especially the next 30, 40 years when we're all going to be in there, and we kind of want the healthcare industry to be fixed by then, right? Because if not, then we're screwed.
I know I worry about my boss and them, the
Yeah,
older ones in the organization that are going to be on Medicare in 10 years or so here. It's it's definitely something to think about.
you'll never be able to move up because they'll be working at Jefferson until they die, and they'll be taking the Jefferson health plan, right? The benefits, right?
They
So
will.
that's how we got to fix this. We got to fix it now. But no, hey, thanks a lot, Cole. I appreciate it. This was fun.